Acne vulgaris is a multifactorial chronic inflammatory disease that affects the pilosebaceous follicles of the skin. It is characterized by both non-inflammatory and inflammatory lesions. The non-inflammatory lesions include open and closed comedones, which are also known as blackheads and whiteheads. The inflammatory lesions include papules, pustules, and nodules, and are found deeper in the skin, and are often a sign of a more severe type of acne. Acne primarily affects adolescents and young adults, but it may occur at any age. Approximately 50 million Americans struggle with acne, and 85% of these individuals are teenagers. Acne also affects about 12% of adult women. Those who suffer from acne also may experience other serious health issues, such as depression, anxiety, and poor self-image. These issues can occur simultaneously with the presence of acne, but also may persist even when the acne is resolved. Acne costs about $3 billion per year. Conventional therapy regimens for each acne severity, mild, moderate, and severe, are shown in the table. Most doctors and dermatologists follow this treatment plan and deviate only if the patient asks for a different kind of regimen or if the healthcare professional believes the bacteria being treated is resistant to the topical or oral medication. Alternative therapies include tea tree oil, bee venom, and herbal remedies such as barberry extract, various Ayurvedic compounds, especially Sundurvati, Rhodomyrtus tomentosa leaf extract, brown seaweed, and 5% lactobacillus fermented hinoki cypress tree extract. Additionally, psychological therapies may be used to combat the negative, intense psychological side effects of having acne. These therapies include biofeedback-assisted relaxation, cognitive imagery, and hypnosis. The development of an acne lesion begins with follicular hyperkeratinization, which consists of abnormally rapid shedding of skin cells in the sebaceous gland. This is often coupled with an increase in the production of sebum. At this point, the pilosebaceous follicle is a prime environment for the colonization of the bacteria Propionibacterium acnes. As the bacteria proliferates, the affected individual's immune system responds with an inflammatory reaction. Other influences on the pathophysiology of acne include neuroendocrine regulatory mechanisms, diet, and genetic factors. An individual's innate and acquired immunity also play a role in the management of the bacteria on one's face. As mentioned in the previous slide, P. acnes proliferates and triggers an immune response. This occurs when P. acnes interacts with toll-like receptors in the skin. Tea tree essential oil is derived from the pro-inflammatory cytokines. It is often combined with the carrier oil or gel. It is applied topically to superficial keratinocytes, such as cuts. These keratinocytes produce MMPs, which are endopeptidases that cause a rupture. Tea tree oil is anecdotally found to be effective for the primary cause of an acne lesion, based on antimicrobial, antibacterial, and anti-inflammatory properties. The development of acne, because some of the mechanisms are unclear or aren't fully understood. The first study we're going to look at is titled The Efficacy of 5% Topical Tea Tree Oil Gel in Mild to Moderate Acne Vulgaris, a randomized, double-blind, placebo-controlled study. This study aimed to determine the efficacy of 5% topical tea tree oil in treating mild to moderate acne vulgaris. The 60 participants were 15 to 25 years old and had mild to moderate acne. Mild to moderate acne was characterized as less than 20 to 50 comedones, papules, and pustules, and an absence of cysts or nodules. Participants were randomized to one of two groups, a 5% tea tree oil gel group and a placebo group. Each group applied tea tree oil gel or placebo gel topically twice daily, left it on for 20 minutes, then washed it off with tap water. Participants' acne was evaluated every 15 days for 45 days. Researchers used total acne lesion count, TLC, and acne severity index, ASI, to evaluate acne severity. The primary outcome measure was defined as the change in TLC and ASI at the end of treatment as compared to baseline. researchers concluded that a 6-week course of 5% tea tree oil gel reduces both inflammatory and non-inflammatory acne with minimal side effects. Overall, the study found the 5% tea tree oil gel was both safe and effective for treatment of mild to moderate acne. The next study is titled, A Comparative Study of Tea Tree Oil versus Benzoyl Peroxide in the Treatment of Acne. This single-blind randomized clinical trial compared the efficacy of 5% tea tree oil gel to 5% benzoyl peroxide lotion for the treatment of mild to moderate acne. The 124 patients were randomized to either the tea tree oil gel group or the benzoyl peroxide group. Researchers found that both the tea tree oil gel and the benzoyl peroxide lotion had a significant effect in reducing the severity of the patient's acne. The tea tree oil gel was slower acting, but yielded similar results to the benzoyl peroxide lotion. Interestingly, fewer adverse side effects and irritation were seen from patients using the tea tree gel as compared to patients using the benzoyl peroxide lotion. The final study on tea tree oil was an open-label, uncontrolled Phase 2 pilot study that looked at the efficacy of tea tree oil gel and face wash as treatment for mild to moderate acne. The study included 14 participants with mild to moderate acne, which was characterized by 10 to 100 facial lesions, an investigator global assessment score of at least 2, and no more than 2 nodules. Participants were instructed to use the tea tree products twice daily, first by washing the face with 1 pump of the tea tree oil face wash, patting the face dry, and then applying a pea-sized amount of the tea tree oil gel to the acne-affected areas of the face. Participants were instructed to leave the gel on for at least 6 hours. At the end of the study, researchers concluded that the tea tree oil face wash and tea tree oil gel combination treatment significantly reduced acne severity and was well tolerated. Only slight irritation was seen and was easily self-resolved. 5% tea tree oil is a safe and effective alternative therapy for mild to moderate acne. Higher concentrations may cause irritation or other adverse side effects. Tea tree oil may be used as a standalone therapy for acne or may be used in conjunction with conventional therapies. The next alternative therapy for acne is bee venom. Bee venom is an herbal remedy that has roots in traditional Chinese medicine. Historically, purified bee venom has been used in treating rheumatoid arthritis, cancerous tumors, and various pains. Its anti-inflammatory and antibacterial properties are said to be beneficial for these conditions. The first bee venom study is called Effects of Cosmetics Containing Purified Honey Bee Venom on Acne Vulgaris. This double-blind, placebo-controlled, split-phase study with left-right randomization looked at the antibacterial effect of purified bee venom and its efficacy in cosmetics as treatment for mild to moderate acne in male and female Korean subjects ages 12 to 35. The 12 subjects are randomized to receive PBV-containing cosmetics or PBV-free cosmetics. A total of 4 milliliters of the cosmetic was applied topically twice per day for 2 weeks. Concentration of PBV was 0.6 milligrams per milliliter in the PBV-containing cosmetics. Results showed a significant improvement in acne lesion count and severity in the PBV group. No adverse side effects were reported. The next study was a non-comparative study that looked at the efficacy of purified bee venom serum as a treatment for mild to moderate acne. 30 participants ages 12 through 33 were instructed to apply 0.6 to 0.9 grams of PBV serum on the entire face twice daily for 6 weeks. Clinical evaluation by dermatologist occurred at baseline, 3 weeks, and 6 weeks. The dermatologist used the modified Cook's acne grading scale to evaluate acne severity, along with additional assessment scales to evaluate acne lesions and facial irritation. Image-based assessment was also used. Researchers found a significant improvement in the appearance of acne as seen in the decrease in mean acne grade. Additionally, participants showed improvements in open comedones, closed comedones, papules, pustules, and nodules after 3 to 6 weeks of PBV serum use. The last bee venom study is an animal model study where researchers looked to investigate the effects of purified bee venom against P. acnes-induced inflammatory skin disease. 38-week-old mice were intradermally injected with P. acnes in each ear. A PBV and Vaseline mixture was then applied to the surface of the right ear. Immunohistochemical staining, immunofluorescence staining, Western blot analysis, reverse transcription polymerase chain reaction, nuclear protein extraction, and an electrophoretic mobility shift assay were used to determine that PBV inhibited inflammation in P. acnes-induced skin disease and inhibited the expression of pro-inflammatory cytokines, toll-like receptors, CD14, and inhibited DNA binding activity of transcription factors. Researchers noted that lower concentrations of PBV are safer than higher concentration, defined as 100 micrograms per milliliter, as higher concentrations may lead to instability of human lymphocytes. Bee venom was shown to be effective in reducing acne severity in subjects with mild to moderate acne. No major irritation or side effects were seen. However, there is a lack of human trials to test the effectiveness of PBV. Additionally, there are no studies that compare PBV with conventional therapies, and there are also no studies that look at the interaction of PBV with other therapies. Future studies should focus on human-based clinical trials with randomized and controlled experiments. After reviewing the studies on tea tree oil and bee venom, we can conclude that both are effective alternative therapies for mild to moderate acne. If a patient is hoping to incorporate an alternative therapy in their acne fighting regimen, they should first discuss the opportunity with their dermatologist or doctor. They can use this alternative therapy with or without conventional therapies, but it should be noted that an alternative therapy often takes slower to work than conventional therapies. Both should be diluted properly and should not be used at high concentrations. Future studies in this area should focus on human clinical trials that compare the alternative therapy to a conventional therapy. Additionally, it would be extremely beneficial to create a universal grading scale for acne severity. This would make the results of the studies more valid and would create uniformity amongst the studies. For many skin-related disorders, alternative therapies are still up and coming, and many still need to go through clinical trials in order to be deemed effective. Two promising alternative therapies for psoriasis include aloe vera and Oregon grape. In two different controlled studies, aloe vera was shown to be effective in clearing psoriasis plaques as compared to a placebo or conventional therapy. The effectiveness of the other alternative therapy, Oregon grape, was shown in 3 clinical studies. All 3 concluded that Oregon grape was a safe and effective alternative for psoriasis. For acne, many in vitro studies showed the effectiveness of alternative therapies on reducing or eliminating the activity of the bacteria P. acnes. However, fewer human clinical trials exist. One promising alternative therapy that does have human trials to show its effectiveness is barberry extract. 2 different placebo-controlled trials showed that barberry extract was safe and effective in treating mild to moderate acne. For all of these alternative therapies, more clinical trials should be done to ensure that they are safe and effective.